Hi friends, I'm Dr. Mayur Kardile. I'm director of Pune Spine Institute, and it's been my constant effort to educate our patients about their spine health. Have you heard of people having neck pain and then that pain going down into their arms and complaining of weakness or tingling numbness? At times, this problem may be because of wearing out of the disc in the cervical spine. And then we are going to talk about an interesting treatment way for this, which is cervical disc replacement. So let's take a deep dive into it about what exactly is cervical disc replacement, how exactly it is done, who are the patients who could benefit out of it, and what are the advantages of this procedure. Friends, a neck is a mobile structure, and this mobility is because of cushion-like pads or intervertebral discs in between the bones in the neck. At times, due to certain reasons like aging or some trauma, these discs wear out and then they start creating pressure on the nerves of the spine. Typically, the nerves that come out of the neck area supply the arms. So, if this causes pressure on the neck nerves, the pain radiates down into the arms. At times, these patients also complain of weakness in the arms. At times, if this pressure is created on the cervical spinal cord, people also complain of wobbliness or clumsiness in their gait. So, the traditional way of treating this to do a ACDF surgery. In ACDF, the damaged cushion is removed and the bones are stuck together. They're locked in a position so that they don't move. That surgery has been doing well. However, it restricts motion in that motion segment. So here comes the role of this ultra-modern treatment of cervical disc replacement. So what exactly we do in that is that we remove the damaged disc and we replace it with a metal on poly kind of a device which restores alignment, removes the pressure of the nerves, and also maintains motion. Yes, maintaining motion is the crux of cervical disc replacement because once we treat that motion segment and restore the mobility in that segment, we are making sure that your symptoms go away, the pain goes away, but at the same time, we're not stressing out on the adjacent segments. And that is the biggest advantage of this procedure. The fact that we're not fusing the spine also means that this is going to give you faster recovery. So, who are the candidates for cervical disc replacement? So, majorly patients suffering from cervical radiculopathy, as we discussed, that pinching of the nerves in the neck and the pain going down into the arms, or having weakness in the arms, or having clumsiness in the arms, those are candidates for cervical disc replacement. This should be accompanied with a MRI evidence of significant pressure on the nerves at 1 or 2 levels, which can be treated with cervical disc replacement. Now, of course, if patients have tried non-operative treatment, which could be in the form of medicines, physiotherapy, lifestyle modifications, and not getting better out of that, those are the patients who can consider cervical disc replacement. Now, there are definitely certain contraindications to this procedure. Patients who have had prior infections in the spine, or who have had tumors in the spine, or who do not have a good bone quality, or patients who have had 3 or 4 levels of degenerated disc disease in the cervical spine with severe facet arthritis, these are the patients who may not benefit out of it. So those are the relative contraindications of this procedure. Let's know what are the pre-operative and post-operative care to be taken for this procedure. Definitely, visiting a qualified spine surgeon to know whether you really need that procedure is a first prerequisite. After assessing you clinically and evaluating the MRI images, the surgeon would decide whether you need this cervical disc replacement procedure or not. And once it is determined that you would benefit out of cervical disc replacement, your surgeon would advise all the preoperative investigations to get your anesthesia fitness and physician fitness so that we could post you for surgery. On the day of surgery, you're taken into the operation theater. This surgery is done under general anesthesia. It takes about an hour and a half for this procedure. And once it is done, there's a waterproof dressing on your neck, and you're expected to have minimal pain after this surgery. The recovery typically tends to be rapid. The preoperative pain does go away by about 70 to 80% in the first few days. Initially, there may be some discomfort in the neck, but that also goes down gradually by about a week or so. And then you could even expect to walk on the same day after the surgery and get discharged about a day or two after the surgery. The post-operative precautions typically are to use a collar around your neck for about 2 to 3 weeks. That is just for your initial comfort. Once you're comfortable, once the pain levels go down, we would start physiotherapy for you and encourage neck mobility. And then with a good physiotherapy and rehab protocol, we can expect complete recovery out of your neck pain as well as your arm pain. Friends, we have extensive experience with cervical disc replacement. A lot of our patients are getting benefited out of this procedure. Of course, patient selection is the key. having the right patient, having the right diagnosis, and then executing the right procedure for them really determines success in spine surgery. So, if you are suffering through neck pain or that pain going down into the arms or having clumsiness into the arms, typically called as cervical radiculopathy, consider visiting a qualified spine surgeon and then taking care of your spine accordingly. If you've liked this video, if you think you could be benefited, if you think your loved ones could be benefited, do feel free to share this video with them. And remember, the treatment or the right treatment for spine starts with the right diagnosis. So if you have any spine trouble, consider visiting a qualified spine surgeon and start taking care of your spine. Thank you.